Hi, I'm Dr. Joe Suker with the Arizona Trauma Association, and this is Trauma in a Flash. Trauma surgeons are trained not only in the surgical management of traumatic injury, but they are also specialty trained in surgical critical care. This includes the management of shock, sepsis, organ failure, as well as ventilator management. Therefore, it's imperative for the trauma surgeon and the rest of the team to maintain a deep understanding of pulmonary physiology. This includes the understanding of concepts surrounding oxygen delivery. Oxygen delivery is a term that describes the amount of oxygen delivered per minute to the systemic circulation. Normal oxygen delivery for an adult at rest is approximately 1,000 cc's per minute. Oxygen delivery equals cardiac output times the arterial oxygen content. Let's start with cardiac output. Cardiac output is equal to the heart rate times the stroke volume. The stroke volume is the amount of blood ejected from the heart at every beat. Think of cardiac output like a train locomotive. As a locomotive, our blood flow moves down the track, our blood vessels. It, of course, is moving boxcars, hemoglobin. As the boxcars reach the lungs, they are loaded up with oxygen. The hemoglobin becomes saturated. Hemoglobin is super cool because it increases oxygen carrying capacity of the blood by 70-fold. Each gram of hemoglobin can carry 1.34 cc's of oxygen. Conversely, every 100 cc's of blood plasma can only carry 0.003 cc's of oxygen. Therefore, the arterial oxygen content is equal to 1.34 times hemoglobin times oxygen saturation of hemoglobin, SaO2, times a conversion factor plus 0.003 times the partial pressure of arterial oxygen, PaO2. In this example, the PaO2 is the caboose. It's an important part of the train, but it's not there for delivering the oxygen. You'll notice if the PaO2 is 100, then the amount of oxygen dissolved in the blood is only equal to 0.3, essentially making this a negligible component of oxygen delivery. Therefore, the greatest impact to oxygen delivery is made by either increasing the cardiac output, or the amount of hemoglobin, or the oxygen saturation. So why measure the PaO2? Because it helps us understand how well the cardiopulmonary system is working. We can approximate what the normal PaO2 should be for a given FiO2 by multiplying the FiO2 by 500. For example, at room air, the FiO2 is 21%. The PaO2 normally approaches 100. If we increase the FiO2 to 50%, then the PaO2 should approach 250 in the average adult at rest. Understanding the relationship of the PaO2 to FiO2 is important. The normal PaO2 to FiO2 ratio in an adult at rest should be greater than 400. However, many factors lower this number, including obesity, lung disease, and pulmonary edema, to name a few. Changing the FiO2 can cause significant changes in the PaO2 without a significant change in the SaO2. Therefore, trending the PaO2 to FiO2 ratio can help the clinician identify problems in the cardiopulmonary system. Thank you for watching this week's episode of Trauma in a Flash.